my son, he has bipolar. My daughter is trans, and she has very specific medications that she needs to take. And then for me, being homeless at like 40, plus years of age with 2 teenagers, I never, ever saw myself being that way,
Oh, I was pretty sick. I have narcolepsy. I'm on methadone. I was laying around and slurring a lot, I just couldn't stand it. It's just too much.
When I was working, I never went to a doctor because I was always working. Never saw a doctor until I got injured. Then I had to see a doctor, and that's when they pulled me off from work. And I started getting angry with myself because I couldn't go back to work. I had to move out of my regular apartment and go into a low-income apartment, and I was still angry.
It was so difficult to find any services that made any kind of sense. I was not happy with the level of care that we were getting and needed to find a place for my kids to get their medication and services, like right away, fast.
I went to call to get an appointment for my primary doctor. She was never available because she was just booked to the point. She was just booked. So I talked to my friend who came out here at Neighborcare. Then he told me that I could come down here and they could get me in quick with a doctor. So I've been here ever since.
The kids got hooked up there, they got what they needed, and then they said, we also have a clinic for adults. You need stuff too.
Medicine doesn't speak the language of our patients, and our patients definitely don't speak the language of medicine. I need to be able to meet my Neighborcare residents where they are. And they don't necessarily fall within the very strict structure that is our current medical environment. And if you don't meet that structure, if you don't fit in, you get lost through the cracks.
She went to the doctors with me, the clinic with me. She went through the operation with me about 4 or 5 months ago. Mm-hmm. Since the operation, I feel stronger. A little stronger, a little more alert. So it's just getting better. Everything's getting better. With our help.
My job, again, is to connect with the residents and help them either getting to doctor's appointments or even connecting them to primary care if they don't have it. He just needed some extra support. And somebody who spoke your language, right?
Yeah, they can understand me. Through the whole thing, she's helped me a lot. She cares, and you can feel that.
The staff are the front of the organization. They interact with our patients. They welcome them. They develop a trusting relationship with them. They begin to work on their goals and help them achieve their goals. And so our staff are the most important part of our connection to the community and to the patients we serve.
Before Neighborcare, I was just feeling fatigued. I wasn't doing anything. I was eating everything. I wasn't exercising. After I got to Neighborcare and they found out what was going on with me, then that's when I started changing my life.
Neighborcare fills all of my personal needs. When I come to a clinic, people know who I am. The relationships are real. And it's been a super humbling experience and helped me as a person mature and develop and do the things that are necessary to be done to keep going and to provide for 2 people. Which is why I come into therapy, It's like I have to keep going. I can't stop.
Inside Neighborcare, it's important that we really do rally together, that we do lock arms, focused on our patients. We're intent on serving the patients who need us, and we'll be here for them long into the future.